Hi people, so let's revise GLUT, glucose transporters and sodium glucose co-transporters. Yesterday I made a video but there were a few mistakes in it and so I wanted to re-record it and do it again. So GLUT transporters are from 1 to 7. GLUT transporter 1 is present in GLUT transporter 1 and 3. They are present in the brain, kidney and placenta, and their function is basic glucose uptake. Now the GLUT1 is also present in the colon and RBCs, whereas GLUT3 is only present in the brain, kidney and placenta. Okay, so that's about the GLUT1. GLUT2 is about rapid uptake and release of glucose. So it is present in 2 for both, you can remember like that. So Priya loves both Sam and Karthik. So P is for pancreatic beta cells and loves L is for liver, and Sam and Karthik small intestine and kidney. So this is where the GLUT2 is present, and its function is rapid uptake and release of glucose. And coming to the GLUT4, it's very important, GLUT4, because that is where insulin dependent glucose uptake takes place. So GLUT4 is present in ASH. Okay, ASH அப்படினா வந்து you can remember 4 for 4 chambers of the heart, so it is present in the heart as well. So ASH la வந்து H stands for the heart, and S stands for the skeletal muscle, and A for the adipose tissue. So it is present in adipose tissue, skeletal muscle and the heart, and it is insulin dependent. Okay, that is GLUT4. And coming to the GLUT5, 5 looks like S, so it is present in jejunum and it is present in the sperm. The main function is fructose transport. And GLUT6 when the function is not known, but you can remember the mnemonic basic life support. That is where GLUT6 is present, that is in the brain, leukocytes and in the spleen. And GLUT7 if you put it the other way, it looks like liver, so it's present in the liver. And sodium glucose co-transporters, SGLT1 is present in the small intestine and renal tubules, and SGLT2 is present in the renal tubules. Okay, so let's see a question with that and revise the whole session again. So the question here is, I'll show you the question. So the question here is like this: in uncontrolled DM, in what cells is there decreased glucose uptake due to insulin deficiency? Skeletal muscle, brain, liver and RBCs. So the answer is skeletal muscle. Why? Because insulin dependent GLUT is GLUT4, it is present in ASH, that is adipose tissue, skeletal muscle and H for heart. So we'll revise it once again from here with this note. So GLUT1 and 3, they are present in the brain, kidney and placenta, and GLUT1 is also seen in the colon and RBCs, and function of GLUT1 and GLUT3 is basic glucose uptake. GLUT2 is present in the pancreatic beta cells, liver, kidney and small intestine, and the function of which is rapid release and uptake of glucose. And then GLUT4, if you see, it is present in the adipose tissue, skeletal muscle and H heart. ASH is the mnemonic, and the function of which is insulin dependent glucose uptake. GLUT5 is present in sperm and jejunum, the function of which is fructose transport. GLUT6 function is not known, but basic life support is a mnemonic, so it is present in the brain, leukocytes and spleen. And GLUT7 is present in the liver. Okay, that's it guys.